Hey guys, it's Ryan, and welcome to my bonus oral pathology video. So, this is everything we've talked about so far, and if you haven't already, I would definitely recommend watching our entire series on oral pathology. And I know it looks overwhelming, but we broke it down to the most high yield information in bite sized pieces with little memory tricks. And as you will see, this information will really help you on the board's exam. So for this video, I thought it would be a good idea to kind of put everything together by going through some practice questions. So I compiled several questions for us to go through together from old released questions, practice books, and questions that I modeled after actual exam questions when I took the exam. So these are going to be very, very similar to the questions that you'll see on test day. And as always, feel free to pause the video after I read each question and think through the answer choice before we go over it together. So, one of the primary etiologic agents of aphthous stomatitis is proposed to be A. cytomegalovirus, B. staphylococcus, C. herpes simplex, D. human leukocyte antigen, and E. candidiasis. So go ahead and pause the video and then we'll talk about this. Okay, so for each question, let's break it down and start with what we know. Always start with what you know. So aphthous stomatitis may sound unfamiliar, but we know what aphthous ulcers are, and it turns out it's just another name for it. So if we think about the category for aphthous, it was in the mucosal lesions immunologic category. And if we look at these answer choices, we have cytomegalovirus, which is a virus, and herpes simplex is also a virus. We have staphylococcus, which is a bacteria, and candidiasis, which is fungi. So virus, bacteria, and fungi are all in the infectious category for etiology. And probably the only really unfamiliar answer choice here is D. And even if you don't know exactly what human leukocyte antigen is, it sounds like something to do with the immune system because you have leukocytes, which are white blood cells. You have antigens, we know antigen presenting cells are in the immune system. And it turns out HLA is a complex used for self recognition by the immune system. And because we know that aphthous ulcers were in the immunologic category when we're talking about these lesions, although the exact etiology is unknown, we can safely presume that D is the only answer that makes sense here, because aphthous stomatitis or aphthous ulcers are immunologic in nature. So the moral of the story here is even if there's something in the answer or in the question that you've never heard before, just take a deep breath and start with what you know. And you can make some strong logical conclusions that will lead you to remove incorrect answers and be left with the correct answer. Okay, so next, intracellular viral inclusions are seen in tissue specimens of which of the following? A. Solar colitis, B. Minor aphthous ulcers, C. Geographic tongue, D. Hairy leukoplakia, and E. White sponge nevus. So go ahead and pause the video and then we'll talk about this. Okay, so you may say, well, I don't remember us talking about viral inclusions at all in the videos. And this type of thinking can spiral out of control pretty quickly. So instead, take a deep breath and remember all the things that you've studied. In these videos, we covered more than 90 to 95% of all the information you'll need to know to answer these oral pathology questions. So let's go over what we talked about. So solar colitis is another name for actinic colitis, and we talked about actinic meaning solar. And so this is going to be caused from sunlight. So nothing viruses associated with this one as far as we know. Next, minor aphthous ulcers, which we just talked about in the previous question, is immunologic in nature. So again, no viruses mentioned here. For geographic tongue, maybe you don't remember too much about this one. It was in the developmental videos. Don't remember anything about viruses being talked about for this one. We'll skip D for now, and white sponge nevus was in the hereditary video, so we know it was inherited by some gene pattern. And then D is our only answer that we're left with, and hairy leukoplakia, like we talked about, is caused by the Epstein-Barr virus, or EBV, and it's common in AIDS patients that are immunocompromised. So hairy leukoplakia is the only one here that's caused by a virus. And so this question is just kind of a convoluted way of asking which of these lesions or diseases are caused by a virus. And so D is our answer here. So next, Sjogren's syndrome has been linked to which of the following malignancies? A. Leukemia, B. Lymphoma, C. Pleomorphic adenoma, and D. Osteosarcoma. So pause the video and then we'll talk about this. Okay, so for this question, we don't actually need to know any of the nitty-gritty details about the mechanism here, just the high-yield facts. So Sjogren's syndrome involves lymphocytes. So the most logical conclusion here would be lymphoma, and you'd be right. So replacement of the parenchymal functional tissues of salivary glands with lymphocyte infiltrate is the exact mechanism, rendering the glands pretty much useless. But we don't need to know that as much as knowing, well, Sjogren's syndrome involves lymphocytes, so lymphoma is the logical conclusion. Now, answer choice C is certainly tempting and a trap answer because we know it has to do with salivary glands and so does Sjogren's, but also if we read carefully, it said malignancies, and pleomorphic adenoma was a benign tumor, so we could rule that one out actually right away. But if you remember lymphocytes linking to Sjogren's syndrome, you can be much more confident about selecting the correct answer, lymphoma. Okay, next. Acantholysis, resulting from desmosome weakening by autoantibodies directed against the protein desmoglein, is the disease mechanism attributed to which of the following? A. Epidermolysis bullosa, B. Mucous membrane pemphigoid, C. Pemphigus vulgaris, D. Herpes simplex infections, or E. Herpingina. And go ahead and pause the video, and then we'll talk about this. Okay, so for this question, even if we didn't know what acantholysis meant, we can get rid of the excess information in this question and hone in on the key facts like we've been doing. So autoantibodies, this word is extremely important and should clue you in to two of these answer choices, either pemphigus or pemphigoid, because both of them are autoimmune or the immune system attacks its own body. And maybe you'll remember our little memory trick here with pemphigus is above and pemphigoid is below. And that means pemphigus is attacking the desmosomes in the above layers of skin and mucosa, while pemphigoid attacks the basement membrane lower down. And if you remember this, well, we have desmosomes, so we're talking about the above layer that's causing or that's a part of this autoimmune attack. So if we're talking about above, we're talking about pemphigus. And C is our right answer for this question. Next, HPV has been found in all of the following lesions except one. Which one is the exception? A. Oral papillomas, B. Verruca vulgaris, C. Condyloma acuminatum, D. Condyloma latum, or E. Focal epithelial hyperplasia. So go ahead and pause the video, and then we'll talk about this. Okay, so for this one, we actually, when we talked about viruses, we talked about the specific HPVs for all 4 out of 5 of these lesions. So if you remember that, that's bonus. I didn't actually get tested on any of those specific numbers, but like I said in that video, I think they're still important to remember. So if you remember that, this answer will come pretty straightforward. But this one is important to know because the names this proves that the names are very important for each lesion. So for condyloma acuminatum, that one did have HPV, whereas condyloma latum is actually secondary syphilis, which is bacterial. So we can rule out D as being HPV involved, and D is our correct answer here. Next, which one of the following syndromes commonly presents with light brown patchy macules, or café au lait spots? A. Neurofibromatosis type 1, B. Gardner syndrome, C. Osler-Weber-Rendu syndrome, D. van der Wood syndrome, or E. von Recklinghausen's disease of bone. So pause the video and then we'll talk about this. All right, so for all of those mathematical equations or the syndromes that we talked about, I promise they will come in handy because this question is very similar to actual board exam questions. And so the question may or may not include this detail about light brown patchy macules, but the café au lait spots is something we talked about. So I'd have an idea of how they present. But nevertheless, this question does include that piece of information. So what we'd have to do is remember which of the syndromes involves these café au lait spots. And turns out there are only really two syndromes we talked about, and that is the McCune-Albright syndrome and neurofibromatosis type 1. And so if you're able to remember that, then this question would come pretty easily, and A would be the correct answer. Now, one kind of tricky thing, which the exam makers tend to do, is they threw in this von Recklinghausen's disease of bone. If you remember, another name for neurofibromatosis type 1 was von Recklinghausen's disease, but without the bone part. So they just kind of threw that in there to try to throw you off your game. But if you remember the two syndromes that involve those café au lait spots, you'll get this question no problem. All right, question number 7. Conservative surgical excision would be appropriate treatment and probably curative for which of the following? A. Nodular fasciitis, B. Fibromatosis, C. Fibrosarcoma, D. Rhabdomyosarcoma, or E. Adenoid cystic carcinoma. So go ahead and pause the video and then we'll talk about this. Okay, so the word conservative should grab your attention right away. This is an important detail, and it allows us to rule out all the cancers right away. So we can rule out these sarcomas and carcinomas because malignancies are always going to be treated with a more aggressive surgical resection. So conservative is definitely something that rules out these cancers. So that leaves nodular fasciitis and fibromatosis, which we happen to talk about in one of the videos right after one another. And because they're very similar in some ways, the only big difference is that one is easy to treat and one is difficult to treat. So if you remember that, the one that's going to be easier to treat and can be treated more conservatively is A, nodular fasciitis. All right, question number 8. A cutaneous maculopapular rash of the head and neck preceded by complex spots in the buccal mucosa would suggest which of the following? A. Primary herpes simplex, B. Rubeola, C. Varicella, D. Primary syphilis, or E. Actinomycosis. So go ahead, pause the video, and then we'll talk about this. Okay, so for this one, this is basically strict name recognition, and complex spots was one of our main buzzword for measles. But we don't see measles here, so the important thing to know is that rubeola is an alternative name for measles. So if you remember that, then you will be right in selecting B as your right answer. All right, so number 9, which syndrome classically contains lesions on oral, ocular, and genital regions? A. Sutton disease, B. Behçet syndrome, C. Neurofibromatosis, D. Sturge-Weber syndrome, or E. Stevens-Johnson syndrome. So go ahead, pause the video, and then we'll talk about this. Okay, so for this one, again, if you can remember one of our buzz phrases, Behçet syndrome should pop out in your head as being the triad of lesions in oral, ocular, and genital regions. But one of the trap answers here I wanted to point out would be A. Sutton disease, because Behçet syndrome involves these aphthous-like ulcers in the regions, and Sutton disease is another, basically a synonym for the major form of aphthous ulcers. So you may be tempted to select that answer, but the key for Behçet syndrome is, again, affecting this triad of classic regions. So if you remember that, then you will have selected the right answer, being B. All right, number 10, the odontogenic neoplasm, which is composed of loose, primitive-appearing connective tissue that resembles dental pulp, microscopically is known as which of the following? And because my voice is starting to hurt, I'm going to leave you to read these answer choices. So go ahead and pause the video, and then we'll talk about this. Okay, so for this one, basically, one of the important things to remember is that this connective tissue is resembling dental pulp. And so it's primitive appearing, it's very loose connective tissue, and you may remember one of our silly memory tricks being the slimy stroma myxoma, which is talking about this myxomatous connective tissue that resembles the pulp with very little collagen. And the question conveniently mentions that it looks like pulp. So if we remember slimy stroma myxoma, then we'll remember and be drawn to this answer choice E. And if you did, that would be the correct answer. All right, next one. Which of the following odontogenic cysts occur as a result of stimulation and proliferation of the reduced enamel epithelium? So go ahead and pause the video, and then we'll talk about this. All right, so for this one, again, as you can see, a lot of these answers are relying on the high yield facts that we mentioned, those underlined words and the red font words we had in the videos that we've been through together. And so if you remember, the reduced enamel epithelium was one of those tooth embryological structures involved in the formation of dentigerous cysts, which are accumulations of fluid between the crown and the reduced enamel epithelium. So for this one, A would be your answer. All right, number 12. Two cystic radiolucencies in the mandible of a 16-year-old boy were lined by thin, paracaratinized epithelium showing palisading of basal cells. All teeth were vital, and the patient had no symptoms. The patient most likely has which of the following? So go ahead, think about this question, and then we'll talk about it together. Okay, so for this one, you can hone in on some of the key words that were mentioned, those being thin paracaratinized epithelium and palisading of basal cells, which is something we didn't mention in our videos, but we certainly talked about this paracaratinized epithelium. And that is basically pathognomonic, or points you directly towards the KCOT, or the odontogenic keratocyst. And remember those two terms, keratocystic odontogenic tumor and odontogenic keratocyst, have been used interchangeably within the last several years. So don't let you throw that off guard. Don't let you have that throw you off guard if you see one or the other. When it says cyst in the question or tumor, sometimes they can be written either way, like we talked about. And again, as you can see, a lot of these boards questions are directly linked to the buzzwords and high yield facts that we talked about. And that'll be true for at least 80 to 90% of these boards questions. So focus on really learning those high yield facts for each lesion really well. All right, so next question. When a diagnosis of odontogenic keratocyst is made, the patient should be advised regarding to which of the following? So go ahead, pause the video, and then we'll talk about this. All right, so for this one, answer choice B is really tempting for sure because we talked about a lot of syndromes that involve these colonic or intestinal polyps. So Gorlin syndrome is the one that involves multiple of these KCOTs or odontogenic keratocysts and multiple basal cell carcinomas. But Gorlin syndrome did not involve intestinal polyps. That was the Gardner syndrome. Remember the odontomas buried in the garden, and the Peutz-Jeghers syndrome. Remember PJs with a lot of spots or those freckles. Those were the two syndromes involved with colonic polyps. So odontogenic keratocysts were involved with neither of those, so we can definitely rule out B. For odontogenic keratocysts, one of the things we talked about as being one of the important facts is that it is both aggressive and recurrent. So the associated recurrence rate would be important to tell a patient about. So if you selected C, you would be correct. All right, number 14. A 15-year-old patient has a numb lower lip and pain in her right posterior mandible. A radiograph shows uniform thickening of the periodontal membrane space of tooth number 30. The tooth shows abnormally increased mobility. Which one of the following diagnoses should be seriously considered? So go ahead and pause the video, and then we'll go over this together. All right, so this is a classic case of don't overthink it. If you see an answer that looks appealing and makes logical sense based on some buzzwords or buzz phrases in the question, just select that right answer and move on. So for this one, if you see numb lower lip or lip paresthesia or something along those lines, like we talked about in our videos, numb lip, think malignancy. And it doesn't even give you an option of a specific malignancy. This question just flat out tells you malignancy. So even with all of this other information, it can be a little bit confusing, which one of these would cause tooth to be mobile. I don't know, maybe ameloblastoma is a little bit aggressive. Just think numb lower lip, that is dead on for malignancy. So that is the correct answer for this question. All right, and the last question we'll go over together is one that I took from the second day of the boards exam. So the first day of INBDE Part 2 will be 400 questions like the ones we've previously talked about, and oral pathology questions are sprinkled throughout. And on the second day, you will have 100 more questions that are case-based. So they'll give you information on a patient with some clinical photos and x-rays, but otherwise the questions will be very similar. And here's an example. The patient presents with the following lesion on their ventral tongue clinically. What is your diagnosis? So go ahead, read through this question, pause the video, and then we'll talk about this together. All right, so for this one, the important thing to know here is basically the clinical appearance of the lesion. And I'm just going to jump to answer choice D because papillomas are very distinct in clinical appearance. They're warty, they kind of look like cauliflower in appearance, and they can be anywhere on the tongue, the lips, the gums, the cheek. And they're one of the few lesions that we talked about that you could diagnose simply by looking at it. So don't expect too many questions like this one, other than the lesions that are very different and distinct, like papillomas. Here's another example. You can tell how they're very, kind of similar, and no matter where they are in the mouth, they always have this very classical warty cauliflower appearance. So for this one, if you selected papilloma, you'd have the right answer. All right, guys, so those are all the questions I put together for this video. I really hope you found it helpful to kind of tie everything together, some information from each of the videos that we've talked about previously. I wish you the best of luck in studying for boards part 2, and I hope I was able to help you along the way in your studies. So if you like this video, please leave a thumbs up, subscribe to my channel if you haven't already for more on oral pathology, on boards preparation, and other things dentistry. Thanks so much for watching, guys. I really appreciate it, and we'll see you all next time.